Well, I'm very glad to have been invited today to the vaccine clinic here at Thorncliffe Park, and I'm delighted to be joined by Denny Petkovsky and some members of the team that are running this clinic day in and day out, and they're a part of both Michael Garron Hospital and the East York Health Partners and have done a great job throughout all the time that we've been vaccinating. And I know that this community has rallied over time to make sure that our vaccine campaign can be the kind of success it must be. It's not an option for us not to have this campaign be a success, and I want to thank everybody involved in making that happen. Whether it's healthcare partners or whether it's volunteers, nurses, doctors, community ambassadors, or local community organizations, you name it. We are in a situation where all of those people have combined to a great team effort to make sure we get people vaccinated in our city. And I do want to issue a special thanks to Michael Garron Hospital, who have been from day one of the vaccination period leading the campaign here in Thorncliffe Park and throughout the east end of the city. This clinic has been a pillar through the vaccine push, and even today on a beautiful Sunday in the summer, lots of people are out to get vaccinated. I've talked to them in the lineups, and it's some kids who are just turning 12 who are now able to get vaccinated. It's people coming for their second shot, some coming for their first shot. And I would just remind people they can come here to this clinic and many of the other clinics 7 days a week. They can walk into pretty well all the clinics now without an appointment, or they can make an appointment, whatever makes them feel more comfortable. I'm very proud to announce we've reached another milestone today, and these are not milestones at all to be complacent about, even not too celebratory, but I think they're worthy of marking as we make progress, which is that as of today, we have 75% of the people of the City of Toronto who are eligible fully vaccinated, namely they've received the 2 doses. And this is a huge achievement by Team Toronto and by the residents of the City of Toronto and all the people that have helped them to get vaccinated. And so I want to say thank you to all the people that have been involved in reaching that milestone, knowing full well it's not a milestone that represents the end, it represents a midpoint in what we have to do. We know that our vaccine uptake numbers are going quite well, but we also know the need to do more and the need to get more and more people vaccinated to protect them from the variant. And you can see from the numbers that are out today, this is still a cause of major concern, major concern. The numbers are going up. In fact, I just have written down here, our 7-day rolling average as of August the 6th was 42 new cases per day. As of August 18th, that number has risen to 116. We have seen this before, and we know this is a cause for concern. It's a cause for us to redouble our efforts to be careful, to wear masks, to avoid unnecessary crowd scenes, and to get vaccinated, because that is the most powerful weapon that we have against getting COVID-19. Getting vaccinated protects Thorncliffe Park, where we are now, but it also protects everybody across the city, whether it's people you live with and you love, or whether it's people you work with, or anybody else. And it's also about protecting the upcoming school year. I was very gratified to talk to some of the kids that are turning 12 this year who are eligible now just in recent days to get vaccinated. They're here getting vaccinated. But thousands upon thousands, hundreds of thousands of kids will go back to school in just a very short period of time. And we want to make sure that they are protected, that their families are protected, that our educators, our teachers, and others who work in the school boards are protected as we head back to school. Because, again, a top enemy as we fight this variant is going to be community spread, which can be caused by any people in that circle not being vaccinated and carrying it into different places where people are exposed. People are just getting back to work now too. Our main streets are starting to revive themselves. There's a sense of life in some of the streets and the stores and the restaurants and businesses of the city. And why do we want to put that at risk? And you look at what's going on elsewhere and you can see that there is a risk that is posed by these numbers and by this variant, and we have to fight that. And the best weapon we've got in this fight is the vaccination. We do not want to go back to any kind of a lockdown. We want to be safe. We want people to be healthy. We want businesses to be able to employ people and to be healthy once again, and that requires vaccination. So that is why the city announced last week that it will employ a mandatory vaccine policy for its own employees. And those are, of course, tens of thousands of people who work for you. And they work for you, often facing you in the community and doing different jobs, whether it's transit or policing or firefighting or a host of other things. And we have brought forward a policy that says they must be vaccinated absent a medical exemption. Our Medical Officer of Health, Dr. Eileen Davila, with whom I spoke this morning about the numbers, strongly recommended that all local employers institute a COVID-19 vaccination policy. And we also have put in place a toolkit online to help businesses to have such a policy. And I'm gratified at the fact that some bigger businesses have come forward in the last few days, really following and alongside the city's initiative, and have taken steps to say to people, you must be vaccinated to come back to work. And I know there are some people who have concerns about this, but in the end, it's about our collective well-being. The city's website, you can also, if you're a business, apply to host an on-site vaccination clinic if you wish to do so. And so I would urge people to take a look there, and we can then process those and have vaccination clinics, which can make it very easy for people to get first or second doses at the workplace. And I want to thank the employers who are stepping up and doing the right thing, either having us put on a clinic or just having policies in place that require their employees to do so. We all need to get vaccinated to bring this pandemic to an end. And our health officials have been very clear that vaccines are the best way in which we can get that done. I repeated some numbers last week, and I'll repeat them again today because they're so important. Since May the 1st, 98.7% of people who have been hospitalized here in the City of Toronto were individuals who were not fully vaccinated. So almost all the people who came down with COVID and had to go to the hospital were people who were not fully vaccinated. In the tragically fatal cases of COVID-19, people who died from COVID-19 from May 1st to August 7th, 97.7% of them were not vaccinated. And you've heard of cases where people who are vaccinated can still get COVID-19, but there's a much better outcome for those people, as evidenced by these numbers I just gave you. They don't end up in hospital, and they don't end up losing their lives because they have been vaccinated. In many cases, it protects you completely against getting COVID-19, but even in those cases where there is what they call breakthrough infections, the outcome is much better than if you're not vaccinated. These COVID-19 vaccines save lives and reduce suffering for people and reduce the risk for you and your family and the people that you work with. So I would urge you to get vaccinated, and I want to finish with just a few words about the facts, because there's a lot of misinformation out there, a lot of mistaken impressions that have been created. Vaccines have been saving lives for decades and decades and decades. For decades and decades. As a society, we have largely eradicated smallpox and polio. And these were terrible diseases that used to cause people to have permanent disabilities and to lose their lives. And because of vaccines, we've largely, from the world at large, eradicated those terrible diseases. Is there anyone who would really argue, based on history, that we should let people suffer and die from these illnesses, including COVID, when we know there is an answer that protects most of the people the vast majority of the time? We arrived some time ago at the point where saving lives and preserving our collective health must be at the core of what we do and how we act. The eradication of this pandemic will in fact restore and strengthen the free society that we live in and allow people to participate in more unrestricted activities, or in more activities on an unrestricted basis. Here in Toronto, we've done a great job, where we've addressed questions of supply. We've done all kinds of things to give people access, removing barriers for those who find it a bit harder to get vaccinated. We've done everything we can to find innovative ways to educate people and reduce their anxiety about vaccinations. And the team effort has produced results in our city that are remarkable in a global context. Among major global cities, Toronto is ranking very high in terms of what we've done, reaching the 75% today fully vaccinated, and of course over 80 having received the first dose. But now it has become more challenging for us to get the rest of the way there, and that is why we need your help just at the time when this virus is taking another run at us. And make no mistake, that's exactly what's going on here. You've seen it in Europe, you've seen it in the United States, and you see the numbers increasing here. This pandemic is not over. It is not over. The numbers I referenced earlier show there is a serious risk to unvaccinated people in particular. We can't simply shrug that off and say it's their problem, because their problem is our problem, because of the risk of community spread and because of the risk of those people spreading it, unknowingly of course, to other people. They pose a risk to themselves by not getting vaccinated, but they also pose a risk to everyone else. We have an obligation to the unvaccinated, and they have an obligation to the rest of us too. Our foundational values, our entire healthcare system, if you think about it, is founded on the notion that we have a collective responsibility. We take a collective responsibility to look after each other. We don't just say it's every person for themselves. We say that our whole system is set up on the basis that we look after each other. And quite frankly, we have worked a way to largely wipe away all the reasons not to get vaccinated, if you think about it. In the early days, there was a supply problem, so we had to set priorities on who got vaccinated. Now, there's plenty of vaccine. In the early days, there were long lineups, and it was hard to maybe get an appointment to get vaccinated. Now, you can walk in to all kinds of clinics, pop-ups and clinics run by the city and a host of others. So that is checked off. And early on, there might have been some concern about the safety of the vaccines, but subsequent to that, we've had months and months of billions of people getting vaccinated, and that can no longer be a legitimate concern. So we need Toronto residents to reach out the hand of friendship. We need them to reach out the hand of reassurance and of comfort and of information and of education and of dispelling myths to those who are unvaccinated, and make sure they know how important it is for them to get vaccinated now. Not a long time from now, now. We need that to start happening in greater numbers on a more consistent basis every single day, and clinics like this are a huge help because they're very accessible. This is not about economics. It's not about law. It's not about politics. It is about health, including the health of our children who can't yet get vaccinated. And the more adults and people 12 and over that get vaccinated, the less the risk is going to be to those children going back to school or even just being at home. I know that we can do this, and I know that we must do this, and the challenge that is now in front of us is exactly that. And I hope that you will see your way clear to get vaccinated yourself or to persuade someone else who's hesitant to get vaccinated, because this is so important to the well-being of our city and staying out of the terrible lockdown periods and periods of loneliness and dislocation that we faced for so many months last year and even into the beginning of this year. So thank you for your attention to this, and I'm happy to answer questions that may be on people's minds.
Thank you so much, Mayor. So I just want to start off, obviously, the city has undertaken a mass effort to get people vaccinated. And you mentioned today that you've hit a significant milestone of 75% of people over the age of 12 who are now fully vaccinated. What's it like to see that?
Well, it's heartening on the one hand, except that it's discouraging a bit, because you know that the 25% that's left to go is a bit more challenging for us. And it's not disheartening, that's the wrong word, but it just fills you with a sense of how much there is left to be done as opposed to how much we have done. These are world-leading numbers, and I commend Torontonians for that. I'm proud of Torontonians for that. But we still have a lot of people, and some of whom are very hesitant, that need to get vaccinated. So we're going to continue to redouble our efforts. I commend the other governments that have had policies to encourage this, and I commend businesses that have put policies in place that have said to people, you must get vaccinated, because it's for the common good, and we're going to just keep our focus on that every single day going forward.
Perfect. I also understand that the city is closing 5 of its mass immunization clinics in an effort to redeploy staff to focus on areas who have low vaccination uptake. What prompted the city to make that decision?
Well, in the early days, it was kind of one of those things where you built it and they would come, and people were so anxious to get vaccinated, and they came and they used the mass vaccination clinics. Now we're at a stage where we have to do a much more targeted approach and literally go to buildings where we know the majority or a significant number of people are not vaccinated, so that we simply concluded that we could leave some clinics open, and I think we're leaving 6 open, but that we would close a number of others and redeploy the resources, the people, and the vaccines to take them out to neighborhoods that have shown a lower level of vaccination. It's just a better use of the resources we have, because it's harder now to get people to flock to clinics, because those who are not yet vaccinated are ones that maybe have some hesitation. But if we go to their door, knock on their door, say you just have to come downstairs to the lobby of the building to get vaccinated, we find that we have a higher level of success. So that's what we're going to do. It's no letting up of our effort. In fact, our effort is going to be increased. It's just doing it in a different way.
Absolutely. I just want to get a better picture of what exactly that's going to look like and how exactly that's going to address vaccination hesitancy, as well as people who have questions or concerns and with barriers to the vaccine. You know, are these going to be nurse practitioners and physicians? Are they going to have direct communication with the residents, having those direct conversations, asking their questions and concerns and whatnot? What exactly is that going to look like?
We're to the stage now where we quite literally are going door to door, and we have people who are going door to door who may be medical professionals, but they may also just be trusted community figures. People who the resident answering the door will recognize from church or from a community organization or from the local food bank. And these are people we're going because we know that if people trust those people, they know them, they're more likely to have a discussion with them about why they're hesitant to get vaccinated. And so the model we're using is very local, it's very targeted, it is going to rely on those trusted people going to the door, and then being able to say there's a clinic right around the corner or right downstairs, because we have to make it easy for people who are reluctant. And so it will be very much focused on having health professionals and others who are trusted spread the word, address the myths, and hopefully convince those people to get vaccinated, and then just have a few steps where they can take them to get it done.
Where are you going to be heading first? What are the neighborhoods that you're going to be focusing on with this new initiative?
The neighborhoods have been the same throughout in terms of some of the higher rates of infection that we saw and some of the now continuing higher rates of infection, and they are kind of in the northwest part of the city, the east part of the city, including the southeast, and including neighborhoods like this. And that's not to blame any of those people at all, but in many cases they have, say, a language barrier. Or maybe they have, seen some things on social media that the rest of us haven't seen because it's in a different language that they have accepted as being fact when in fact it's not true. There are other people who have mistaken impressions that because they stay home with the kids, and don't really go very many places, that it's okay for them even if their spouse has been vaccinated because they go to work. And so we have to go through all of that and in fact draw the connection between kids going back to school, some of the spouses going back to work for those who don't work, and even though you're at home, that there's some danger involved here. And so that's what we have to work at, and we will continue to work at that. But the areas of the city tend to be the areas where we've seen higher rates of infection and lower rates of vaccination for quite some time now, but we just have to redouble our efforts and apply these resources from some of the clinics to more mobile applications where we can make it easier for people to get vaccinated.
Perfect. And I know you mentioned some significant statistics. I'm just wondering, just for my own story today, if you happen to have the number of people who are eligible to be vaccinated but have chosen not to get the vaccine in the city. Do you have that number by chance?
No, we've estimated throughout that there's a relatively small percentage of people who are entitled to a medical exemption or have some other form of valid exemption, but if you assume that's in the single digits of percentages, then it means that the number of people we have left to get fully vaccinated is the difference between, say, 92 and 75. So that's what, 17% of the population of 3 million people. So you're talking here still about hundreds of thousands of people who need to get either a first dose or a second dose. And so it's a considerable number of people, but if you think about the positive and the fact that we've already vaccinated within the city of Toronto in a relatively short time millions of people, then it's a daunting task, but not one that we're shying away from, together with excellent people like the team that are behind me here, representatives of the team. So it's hundreds of thousands of people we have left to go, and we may or may not get to 100%, but that's certainly where we're still striving to get to, because if you could get everybody vaccinated, it provides the maximum level of protection that we can against something that's a very sinister enemy.
Anything I missed that you wanted to add?
No, I'm good, thanks.
Thank you.
If you're happy, I'm happy. You okay? Thank you.